what we wanted to accomplish in this session is to give people 5 minutes to talk about a best practice in teaching health policy. On the slides you'll have, but you've already gotten, I think, thank you, in another format. And do you have the slide advance? He's good. Thank you. Thank you very much. You have the website for some of the resources you're going to hear about today, but also for those of you who have some teaching resources, please, this is a place to go to submit those resources and make them available to everyone. And so what we want to accomplish in this session is, one, to share strategies for effective teaching of health policy to graduate nursing students. We're focused on the graduate level. And to stimulate our creative thinking. I mean, I'm really a proponent of get wild and crazy about what kind of other ideas, new ideas we might come up with. So after we have a few of the more here's what we've done, here's what I've done, you'll get a chance to say here's what I've done. But then maybe we could do this, or maybe we could do this, and get creative with it. So the session will be that you're going to first hear from Karen Gerling about the impact of waste in healthcare on the bottom line. Those materials are on the website. She's going to tell you a little bit about that. Then Pamela Gerke will talk about policy design for success. And then Eileen O'Grady is going to talk about an op-ed assignment, which I tend to think is really important. And then I'm going to share a mock hearing exercise that was actually developed by David Keepnews, and I adapted it, modified it a bit, and David has given me permission to share that with you today. I also posted some of that on the website. And then we're going to open it up for everybody. So with that, I'm going to and each presenter gets 5 minutes. I'm going to be very strict. And then we're going to have about 3 minutes for you to ask some questions about the assignment. And then we'll give people a short time in open session when everybody's done. So we are going to Karen Gerling and the impact of waste in healthcare on the bottom line.
And I'll see how fast I can talk in 5 minutes to tell you about this. Let me give you a little bit of context. This is a course that's a 2-credit course. It's taught to FNP students. It is the last course that they teach right before they graduate, which is actually a good place for them to be because they've already got their skills, they're practicing, they're almost ready to practice, they're scared to death. Works out really well. So anyhow, so there were 2 reasons for doing this. I thought it was an important kind of thing. The course really focuses on both on health policy and on financing. And I do believe that you have to follow the money for these students anyway. It's important. And so this is why I was trying to combine those 2 things. And the other piece was I was really tired of grading papers. So I decided I wanted something else for them to do. So what I did was put together this thing called the impact of waste on healthcare on the bottom line. And I told them that, there's an awful lot of waste that's going on in healthcare. And so that they needed to look at an article that it's found, and this is all on the website, at healthcarepolicybriefs.org, healthaffairs.org, and it's healthcare policy or health policy briefs, and you could look at that and then read that article. It's up on, we're an online program so that they could just pull it up. They clicked on it, they had to read the article, and then the article talks about 4 broad categories. They had to choose one of the broad categories and then put together an article or put together a 10-slide presentation on waste in healthcare and what that meant in terms of policy and in terms of finance and how it would impact their practice because they were totally focused on their practice. This group of students, I don't know about yours, but mine are really not up here in terms of healthcare policy. I do a pretest, and this is the first time I've ever had this, but one person didn't know who the governor of the state of Ohio was, and he was running for the presidency of the United States, and I was mortified. So that's where they are, and they don't care. Some of them weren't even registered to vote, and I told them, don't tell me who you are, because I don't want to know. So anyhow, what they did was they chose all kinds of things to talk about. They talked about antibiotics, they talked about stuff that I didn't even know was available. I mean, those kinds of things. But they really got into it, and they really liked it. And they had to look at finances and what it meant on the bottom line of their practice and what it meant in terms of healthcare and policy and all that other kind of stuff, bottom line kind of stuff, because that's the only thing I could get them to engage in so that they understood the importance of healthcare policy. Because I couldn't get them to go at the higher level because that's not where they are. They were really at the basic kind of stuff. So one of the guys, they really liked it, and so they talked about the fact is that it was a great project to get me thinking big picture on financial decisions impacting our healthcare system. Majority of the course is new to me. I have very little political knowledge or involvement. Taking a moment to learn as a provider what I recommend or order affects the system beyond the patient was a new concept to learn. That's really sad. Healthcare is more than writing a prescription. That's really sad. The project wasn't overbearing, that was good, but gave me the opportunity to research a topic and learn the real financial burden it possesses. And then everybody had to read everybody else's stuff, and there was a great dialogue. I mean, there were 13 students in that class, and they really got into it and learned an awful lot about it. So it was a really good exercise for them. It worked. Sometimes they don't, but it did, so it was good.
Great, great. Any questions at this point about the assignment? All right, thank you. We're now going to move to, let me get on this, Pamela Gerke talking about policy design for success instruction. So
thank you very
to you.
much.
Do you want to do this or want me to do it?
So my slides will be on
Yeah,
there?
they're on there.
Okay.
You have to get it up somewhere.
Okay. I teach in a Postmaster's DNP program at Boise State University, and we have a program that has two policy courses. One is the theory course, Nurse 608, in which this assignment is embedded. The other course is a 2-credit policy mentorship, where students do 50 hours of time with a policy mentor. But for this particular assignment, it's called issue analysis. And it's not something I invented by any means. It was something I learned about from Hanley and Falk in the 2007 edition of Dr. Mason's textbook. And I took the issue analysis format that they developed. I've adapted it over time, used subsequent versions, Dr. O'Grady's information, a lot of other information into this worksheet. And I use it to guide a module in our 608 course. First of all, my students sometimes are like Dr. Gerling's students. They don't have a clue about policy. They don't particularly want to have a clue about policy. And in that case, what better thing to do with nursing students than to give them a good old worksheet? Everybody likes worksheets from kindergarten through college. So the worksheets help to guide a 2-week discussion board assignment. I use this as a formative process that helps them get ready for an analysis paper. So the first week in preparation for the discussion board, they do part 1 and 2. They look at these things in parts 1 and 2, the problem, context, etc. And they post that on the discussion board for their peers and myself as instructor to question, critique, give input, etc. Then, and the next week, the second week, they revise parts 1 and 2 based on the input they got, and they add part 3, which includes what I think is a very important piece, a policy option scorecard and development of the policy solution. The scorecard is important because I require them to come up with at least 4 options for a policy to help blow their minds so it's not just one right way. The third part that happens then later in subsequent weeks is they're using this foundation to help them with their policy papers. So what do students learn? They learn all these things that are on this slide. They expand their minds about the context, the perspectives, the questions that people will ask about their policy issue. They learn to explore new sources of information that didn't even enter their mind to start with. They get some constructive critique and support in a safe and guided environment in the discussion boards. And I think that this really helps them move into deeper learning, with my goal being to prepare them with the knowledge, skills, and disposition to be civic nursing professionals.
Great, excellent. Questions? Any questions? Yes.
I have one. So when you
Go to the microphone if you would, so, yeah.
loud enough, it's not an issue. I guess my question is, when you make them do 4 options,
Yes.
do you let them use the status quo as an option? Because I always tell them if that's their option, then it's kind of, they wasted their time because you're not changing anything.
Well, I actually change it so that if I say you do nothing, so I do make them include what happens if there's a do nothing option, because I want them to realize that is an option. It is still a choice to choose to do nothing.
And I have a question about how long is your policy analysis paper?
The policy analysis paper can be no more than 5 pages. Then in another couple weeks, they have to do a 1-page brief off the same paper. So it's a continual process of going deeper,
Yes.
going deeper, going deeper. By the end of the second week of issue analysis, and we get to what is your policy solution, I tell them it needs to be the coffee cup solution. It needs to be big enough to fit on a coffee cup. And that seems to stick with them because it pops up in the discussion board.
Good for you. I think we do a disservice to students having them write these 20-page papers that nobody's
Yes.
going to read.
Yes.
It takes more skill to be able to make a cogent, compelling argument in a short amount of space. And I hope those of you who are still requiring full dissertations rather than the 3-paper option will consider this in terms of what is the student learning, unless it's qualitative and they're going to put it in a book. I think we had somebody else. Does somebody else have something? No? Good. Good. Thank you. All right, Eileen.
Okay, so I'm going to go even shorter with my assignment, which I'm really excited about. So this was really me learning trial by error. So I was teaching health policy at PACE in a post-NP, DNP program, and had students from all over the world, and mostly ethnic and racial minorities, many of which were first-time college goers in their family getting doctorates. So one of the things I found with my student body was that they were passionate and smart and great clinically, and they were terrible writers. So I first, assigned this op-ed assignment, just write a 750-word essay. And, surely at the doctoral level, well, it was a disaster. So I created a formula. And there's no formula. Op-eds are not formulaic. But it was this idea of going that you're an expert nurse, you're already a nurse practitioner, a clinical expert, you go right to the public, leapfrog over all of the physician structure and opposition, and just go and educate the public. So this was really the process. So they have to identify a topic that fits within the context of cost, quality, and access. And what's the media outlet? So they all go to the New York Times first, and then we go down from there. I don't encourage that, because they have like a 3% acceptance rate of their op-eds. And I tell them that I don't want to see any first drafts of anything. So by the time I get it, it's already been edited 5 times. That's the minimum I tell them. So, that writing is a process, and I don't want to see any errors or typos or things like that. So that's kind of this little bit of a process I had to build in to save my own sanity, that self-care piece we're talking about. Did I skip one? So when they're getting it edited, so they have to contact the media outlet and find out what the word limit is. It's usually 750 words, so it's really short. And, and then when they ask their peers, is it easy to understand? So if you have your mailman read it, does she understand what you're trying to say, what your main point is? It's amazing how much jargon they use, that nursing ease. So cutting all that, is it specific? Ask all these questions. Before I even see it, all this work is done, which, is very self-preserving. So this is my formula. Establish your credibility. I am a nurse practitioner who works in hematology oncology, and for the last 20 years, I've been treating patients with X. So right out of the gate, you have this authority, and try to minimize the role of a student as a doctoral student because it's not relevant to this op-ed. Although it was interesting because the university really wanted their name in the paper and wanted them to be named. They liked throwing their name into the controversy, but it wasn't really relevant, and it seemed to weaken, to me, their authority. And then what's the scope of the problem? How does it impact the public? And think about some grumpy man reading the newspaper at their kitchen table, and what would make them want to read this? So you got to sort of pull them in. Why is this important? And using federal data sources or state, not using weak data, but those stronger sources of data, and marrying it to a poignant story. So the two had to go hand in glove. And then identify what is the solution, specify what you see the solution to that is, and then describe what any action or the public could take, and then predict what will happen if this goes unaddressed. So that was sort of the formula I created so that when I read these papers, I didn't get these cortisol squirts, where they're introducing new ideas at the very end and nothing was hanging together. And this has been a really popular assignment. And one of the reasons I like it so much, and then grading it, I wasn't allowed to give them an A if they got published, but, did it pull me in as a reader? I'm a nurse, I have a doctorate, and if I'm, doing a yawn on the third sentence, it's not going to grab anybody else. So if I can't track what you're saying, so I really use that criteria and use this global scoring to grade them. All of this is on the website. And so here's a guy who was an Air Force captain, and he got published in this Hastings Center, and talked about 20 years as an Air Force officer. He never saw more suffering than he did as a hospice nurse in an inner city hospital in New York City. And that very first sentence just sort of pulls you in, that he has this credibility as a hospice nurse, and the way we're doing this is horrible. And so who wouldn't want to keep reading that, because it's again, nurses' stories. And this ended up being such a game changer for these students because all of a sudden their employers saw them differently, or if their patients saw the article, it was like, wow, you really are an authority, you know what you're talking about. So this idea of going right to the public and using that. This is another woman who is a nurse practitioner and worked in radiology, oncology, and talking about she was really upset about the task force changes and the recommendations for mammograms. And so as an expert clinician in that area and as a cancer survivor, she was very clear about early screening was really important and was against those recommendations. So this, again, changed the way she was viewed in the community. She ended up being pulled up into some larger committee within her community to look at mammograms. So this has been a really popular assignment, really hard to do. And then it also fit into them doing testimony on their, it would get larger, but smaller and larger, so they could see the larger and the smaller. So really hard to write 750 words, but with enough structure, they were able to do it.
So Eileen, what % get published?
I would say 30, 40. And so the idea is that when they submit them, they have to wait, right? That you can't submit to 10 at once. It's one at a time, and you hear back. Sometimes you don't. If you don't hear from us in 3 days, it's not going in. So they would wait to hear back. And then everyone in their community reads these newspapers. They read them. And so it was a really exciting thing. They're all surprised when they get published.
Questions for Eileen? Do you use the op-ed project? Do you refer to that? Do you know about that?
No.
Op-ed project is a project around helping people to develop really good op-eds. They actually do workshops, but usually for pay, but it is a resource.
Okay, and we have a free one on the website.
Yeah, good, thank you. Thank you. And then, there we go. So I'm going to share with you the mock hearing concept. So David Keepnews, for those of you who don't know him, is this brilliant lawyer nurse. And he actually came up with this exercise teaching the same course that then I came in and also taught. And it is a graduate course on urban health systems, but the focus primarily on healthcare systems and policy. And it is one of the required core courses of all graduate students at Hunter College. And for our BSN to DNP students, they also have to take this course. And so David came up with, he's very creative, and he came up with the assignment. It is on the website, but, and I'll share this with you in just a moment. I did adapt it. But I wanted to just share something else with you first, and that is that it was clear to me that the course syllabus and the expected outcomes, that I had a hidden curriculum for these students. I wanted them to develop other skills and talents while they were in the program, competencies while they were in the program. So I would share with them, here are the other expected outcomes for you. And so you can see these, but I want to emphasize the third and the fourth, developing and presenting a clear, concise, compelling position in writing and in person. And they do not write more than a 6-page paper, and they have 3 or 4 writing assignments in the course, and the first is a page and a half. And they have to, if they don't write well, they are referred to. We have developed a peer mentor writing service where graduate students coach their colleagues in improving their writing. And we will be publishing something on that, and maybe I'll share it on the website so others can look and develop. It's so successful, and the graduate students run with it who are the peer mentors, and it's very helpful. And it helps students to improve their success rate in the program. And the last one is effectively working with others and managing the challenges of work groups, working in groups. And you know that these students will tell you, I don't want to do group work, right? And it's because we really don't help to support them in developing the skills to be able to manage in a group and to figure out that life interferes with the best laid plans. And so if Eileen has had something occur in her life but said she would do such and such, that maybe I need to step in and help. And that it is something that you're constantly negotiating. So we want them to work in groups. So this outcome, this mock hearing experience, these are some of the basic elements. The students at the beginning of the semester are assigned to be an interest group. And the interest group could be the Heritage Foundation. It could be the American Hospital Association. It could be the Nurse Midwifery Group, the American Nurses Association, the Academy of Family Physician Group. And they are then to sort of get into the head of that organization and represent that organization's perspective throughout the semester. The students then have, for this exercise, have to find people who are sort of like-minded maybe, and it may not seem like-minded initially, but where can the nurses and the physicians groups agree on something? And so they have to form a coalition and select a policy issue that they're going to address. Now, in some cases, they've struggled with the policy issue, and I've had to help them to find one or I assign them one. Now, David wrote a whole bill. It's a fake bill that he developed, and it was sort of quasi-based on the Affordable Care Act, much shorter, and students all had to testify around that. But I got feedback from some students that why not have us do real stuff instead of something that's made up? So I played with this and had, the last time I taught the course, had students, or maybe it was the next last time, had a federal issue option, a state option, a local city council option, something that was a regulatory issue, something that was a legislative issue. And they got to pick from this list what was the issue they were going to tackle. Now, they were told that if you're in this coalition, you give yourself a name, and then you all have to agree on the position you're taking. And so, for example, when it was something around advanced practice nurses, and somehow Eileen, who was representing the nurse anesthetist, or the anesthesiologist got to the table, and they started speaking in support of giving nurse anesthetists full practice authority. It was like, oh, really? I don't think so. This doesn't work. And so they had to really think through the positions and whether it made a good match. And if it wasn't matching up, then maybe they needed to switch to another coalition. So they had to agree, they had to present, each person had to do a 1-minute presentation of reading a testimony that was concise, had certain elements in it. And then, after everybody did their 1-minute presentation from the coalition, other students and sometimes faculty would come in. We'd invite faculty to be senators, and they would ask questions. So they had to show that they could stand up and make a cogent argument in response to the questions. And then and they could be tough, but the last time I taught it, I was so impressed. The groups were really smart. They caucused ahead of time and went to somebody like Eileen and said, Eileen, you're going to be a senator. Ask us this question. And they planted it. It was actually quite brilliant. And then they got graded on their individual performance, their individual statement, and how they were able to respond to questions, as well as then had a group grade. So there was vested interest in success in the group. Now, this is at the end of the semester. I will tell you, at the beginning of the semester, I asked students to go around and stand up, say who they are, where they work, etc. You know, they can barely hear them. And one of the things I try to teach them is projecting. Present yourself, project. By the end of the semester, they were up there strong, speaking powerfully, and while they might not all do policy, they're not all going to do policy, but they walk away with some real skills about how to present, as well as how to make the connections between what you're doing on a daily basis as a nurse and the important policy issues of the day. And one other thing that I'd like to say, you know, you were talking about the New York Times. I'm appalled at the number of students who come and they don't read a daily newspaper or online source, barely watch television, and if it is, it's a very biased source, whichever way you go. And so I think there needs to be a discussion, too, about what are credible sources and how do you keep that big picture, and that's why the civics course for me in high school was so important. And having a public health nursing teacher who said to me, I can relate anything that's in this newspaper to health, and made us do the same thing. So it's a great exercise, and we'd love for people to give it a try, modify it, make it your own. Okay, any questions on that? Okay, yeah.
Just a comment. I like that you made the students, or that the students suggested to senators what they were going to ask
Yes.
for, because lobbyists do that all the time.
That's right. That's right. Okay, we were gonna work the room, but we won't. We'll sit here and let you get up to the mics. Go ahead.
It's on? Okay. I'm Willa Fields, and I teach at San Diego State University, so welcome to our beautiful city.
Thank you.
I had the same reaction you did in my health policy class, that the students are totally oblivious to what's going on in the outside world. They have jobs, they have family, they're in school. And so in my health policy class, I assign them current events. And they have 5 minutes or less, and they're to find something in the news anywhere, and they're to give a report on it and how it relates to the course objectives. It's just a quick, fun, it's pass-fail, and it really gets them involved, and they thank me for it, because not only do I force them to read yahoonews.com or wherever they want to get it, they listen to all the different places that the other students do, and it's a way to keep them up to date. And I teach this course this semester, and I can't wait to hear the news that they're going to come forward with.
That's great. That's great. You know, there also is a controversy about do you grade for or give credit for class participation. I'm a strong proponent that yes, you cannot be in this course and be silent, and that we have to send the message that full participation engagement is important. Yes.
Suzanne Stabler, Emory University. So I wanted to add a little bit to Eileen's op-ed assignment. So one of the things we do 2 days prior to that written op-ed being due is I call in some favors from lobbyists and legislative staff in our State House, and I ask them to come, and the students have 3 minutes to present that elevator speech to them, and they get real-time feedback about the issue, how they presented, questions they may have, and stuff like that. And then the expectation is that feedback is incorporated into the op-ed assignment.
Great. That's a great idea. Yes, Alexia.
Alexia Green, UNM and Texas Tech. But I have my Texas Tech hat on now. I wanted to share with you, we're talking about graduate nursing programs, master's, doctoral level programs, and mostly people have been referring to policy courses that you're teaching. I wanted to share with you one of the things that we do at Texas Tech with a leadership course that all master's prepared nurses have to take, because they need exposure to this content as well. And Dr. Cherry, who's in the room, and some of my other colleagues actually developed the course. I'm a course leader now for it. But we have 4 modules in an online course for leadership for a master's prepared nurse. And one of the modules focuses on healthcare finance and new models of care. Now, that's another way of saying healthcare reform with a different hat on. Remember, we're Texas. So you can approach it from that perspective as well. And what we have them do in that module, it's an online module, is they have to go to CMS's Center for Innovation and identify one of the models of care in there and then blog about it, or not blog, it's a discussion board, post about it and dialogue with their colleagues about that model of care. Which most of them are focusing on ACOs, all of the new stuff that's going on in healthcare finance. But I think what's most interesting about it is it allows the students, number one, we also ask them to go and look in their own backyard where this model of care is being tested. They don't know what's going on in their hospital. They don't know what's going on in their community. So when they see that it's happening in their own background, in their own setting, that this is actually being tested, then they want to really get more enthusiastic about it and really figure out, what does it mean to me as a nurse leader, and as a consumer, because this is happening in my community. So just wanted to share that with you.
Great.
And that is on the website as well.
Great idea. Yeah.
Good afternoon. Thank you for being here today and representing so many. My name is David LaFevers. I am a professor at the University of Missouri, Kansas City. And there are two things that I've done that seem to elicit the most positive responses, or beginning out negative responses at the beginning of the semester, ending in a positive outcome. The first is today is the first day of the semester for us. My students have 3 assignments that are due at 11:59 p.m. tonight, which already makes me beloved. It's really complicated. What's your name? What's your favorite color? What's your quest? It's not really overcomplicated. But one of these assignments is from what's known as the Political Astuteness Inventory. It is a 37-year-old, it came out in 1984, 40-question survey, yes, no, do you know it? And basically I tell all the students ahead of time, don't look at your initial score because you're going to be frightened. Just trust me, if you honestly answer it, you will get full points for this paper. But what I do is I tell them, you're going to get 10 points. But I give each one of those questions a 0.25 score. So when they get done, they have a really good idea on what they know, or more importantly, what they don't know. I'm involved a lot, and I don't even get a high score on this thing. And then at the end of the semester, I have them retake that same validated tool to let them know. From this experience, I've had students tell me, I didn't know how much I didn't know. This does two things. One, right from the very beginning, when they see that they get an initial score out of a 10-point survey, they get a 1.5, it's a real eye-opener. Okay? It's a real eye-opener. But two, it lets me as an instructor have an idea where the weaknesses are for these students coming in. So I'm very pleased with that. The second thing that I do that the students initially hate me for, but at the end of the semester really say it was an eye-opener, is one of the first things I have them do is they have to do a background check on their elected official. They don't have to do them all. Where were you born? Where'd you go to school? What's your educational background? Are you married? Do you have children? I'm sorry? Yeah, if you get a restraining order, you've gone just a little bit too far. But at least you get a document that you can have matted and framed. Oh, the memories, and you don't get prosecuted unless you break it. But anyhow, then they have to schedule in an appointment to meet with said elected official. I do not require them to make an ask. I require them to develop a relationship. And at the end of the engagement, they are required to get a selfie, okay, to help validate it. Now, if they can't make it with the elected official, then they can go with the LA. But I've had some great stories every semester that I've required this torturous event for them. At the end of the semester, I had one new student go, I really didn't like you very well at the beginning of the semester. I said, so you're telling me you hated me? No, I just didn't like you very well. I said, so you're telling me you're hating me? She said, okay, I hated you. I said, I'm okay. I said, you still hate me? She says, no, because I didn't realize how easy it would be. I didn't realize how easy it would be to develop these relationships. So those are the two things that I'm doing right now.
So I have a question for you.
Ma'am.
So when you have the student go into the legislator's office and not have an ask, so it's like, what am I going to do and say? What do you tell them they're going to do and say?
They are going to develop that relationship. They're going to have something on the back burner, healthcare related wise. And if they go in, one of the things that I've found with them is if they go in knowing more about their elected official than that elected official knows about them, they have a great deal more confidence. And the majority of times, once that ice is broken and once that elected official knows, wow, they know a little bit about me, they can make these connections, many times it goes there.
So you're prompting them to know about a health issue that the legislator has already identified as being of concern.
But that's not something that they have to press at that time.
Gotcha. Yeah.
As an elected official, can I tell you why that works? Politicians love to talk about themselves. Go in there and say, hi, I'm Gail Adcock. I live in your district. I'm a nurse practitioner. I take care of these kind of people. I just came today to meet you, give you my card, tell you I'm happy to be a contact for you on healthcare issues. What are you interested in doing this session? And that 10
Great.
minutes later, you got to excuse yourself
Great.
and get out of it.
Great. Great. What was the name of the tool?
Oh, the Political Astuteness Inventory, the PAI, written by Dr. Janet Clark, I believe, 1984.
Clark.
1984.
Do you have this material on the UNM website?
Not yet, ma'am.
Okay, well, we're going to look for it.
Yes, ma'am.
He's going to send it in.
Great job.
Great. Thank you. Thank you. Yeah.
So just building on what our colleague just said, I'm Lisa Campbell from Texas Tech, and I'm here with my colleague, Dr. Paula Webb. We teach health policy, advancing health policy and politics. And so we do have our students identify a policy issue and a group, and really Paula and I energize the group and get them excited about policy and politics, and I think I believe that that's our role. Then they move from there, they do a causal diagram so they can look at mediators, outcomes, and unintended consequences that often happen with policy. We have them move into developing talking points that's no more than 2 pages, 3 key points like a good sermon. And we vet that before they go and give them constructive feedback. They do a policy brief. And then the throughput is that they actually meet. We do talk to them about establishing beforehand a relationship with their policymaker or somebody of influence, because policies could be getting a mother-friendly workplace policy for a system, a school district, a county or city government, going and talking to the school board. Any of those types of organizations are really important. And then the throughput is that they actually meet with the decision maker or policy maker and offer their talking points, and then offer to be a subject matter expert or contact for them in the future. And our students love the course.
Great.
It's been a great thing.
Great. Excellent. Yes.
Cindy Zolnarek, I'm Executive Director of the Texas Nurses Association. And first, in terms of your question and what you have them say, I will tell you with our membership, and we try to have every legislator in our state have a nurse contact. And we tell that nurse, you go in and you say, hi, I'm a registered nurse, I'm in your district, and I want to be here to support you and help you when you have health care bills that, however I can. I'm your contact, I'll find out the answer if I don't know.
Great.
But I also want to talk about, with all the interest, and it seems like a renewed interest in policy, and we have a poster. It seemed like a real opportunity for faculty who are teaching policy and the Nursing Association to align in terms of how we can do this work together and how students can be involved in efforts that are ongoing. And one of the things that my mentors had a PowerPoint presentation, and one of his slides was, and it had 3 bullets on it. One is, all politics is local and local is the individual. But secondly, it is very difficult for an individual to make any policy change. It's not impossible, but it's very difficult. The most power you're going to get, the third point, is when you work with your association. And the last thing you want is for the association, and we are it for policy in Texas at the state level, at your state level association. The last thing you want is for the association to be saying, this is what we support, and have someone else say, I'm a nurse, and this is what I think. Then you have no credibility. because they'll say, you nurses, you all get your act together and then come to me. So that was part of the initiative, too, is that, yes, we want nurses to talk to legislators, but at least know what and again, not that you have to talk our talk, but at least know what it is. Because we want to know if you're going to say something different, because we lose all our credibility if we're not together. So I think this is a real opportunity for you as faculty to align with what your association is doing in the state and really get the biggest bang for the buck. This is an opportunity to really involve, especially your students, in policy initiatives that are already underway. And I know as not too long ago, I've completed my doctorate, and the last thing you want is to be doing busy work that doesn't make a difference. So this is a real opportunity for your students to have projects that do make a contribution to the greater whole of what's going on.
Great, thank you. Yes?
Hi, Marilyn Dollinger from St. John Fisher College in Rochester, New York. I teach health policy at a bunch of different levels in our program, but one of the strategies I use that the students really enjoy is every student has to do a political cartoon analysis, and we open every class with the political cartoon analysis. And I have a rubric. I basically Googled it off the web and use this. They have to look into who the cartoonist is, a little bit about their history and perspective. They have to identify any symbols used in the cartoon. So the old donkey, elephant, a variety of things that a lot of them know nothing about, so they do that. Then they talk about who the stakeholders might be for this issue, who might agree, who might oppose. And we have had hour-long discussions on some of these cartoons. And it brings in, there's so many teachable moments every time we do one of these cartoons. And it also allows students to express opposing opinions and discuss them and reconcile them and do all this. So that's really popular. The other thing I do in the course is I have a panel of one of our local delegation elected officials from our state government. I have a lobbyist, and then I have a former elected official who was on the health committee in our state government who talks about decision making. And it's really valuable for the students to see that lobbyists don't have horns, and that in fact they have a variety of perspectives and how they're used, and their perspectives and the ethics behind their practice and all of the regulations they deal with, and then speak to a sitting legislator in a way it's very relaxed, it's informal, it takes the onus off of, I think it's a good idea they can do lobbying visits on their own, but this tends to be pretty relaxed. And then I also go through my whole thing about introducing themselves to this panel, and that is you don't introduce yourself by first name only.
Yes,
you give your
thank
full
you.
name.
Thank you.
And in 2 sentences, you know, where you work, what your scholarship area of focus is, and just present yourself professionally, because that's one of my pet peeves. And you would think that these are basic social skills, but we really have a responsibility in socializing them into these professional roles to make sure these are accounted for.
I agree wholeheartedly on that. I'm tired of nurses saying when they introduce, I'm Jane. Well, don't you have another name, Jane? Peter.
Hi, I'm Peter Beerhouse from Montana State University, and I had a recent location in Montana, and I'm now teaching undergrads. And as I was telling our table, they're all about clinical worlds. They don't have anything beyond that, and I get that, and that's great. But it was frustrating. And the other thing I noticed is that they're highly partisan. You know, they were left or right, and, you know, they came in there, and that's the way they were going to be. And so what I asked them to do is I said, if you're sort of on a Democratic leaning, then I want you to write your policy brief from the Republican perspective. And it taught them to sort of think about, well, they're really concerned about costs and innovation and competition and choice. And they walk out of there thinking, you know, those aren't such crazy ideas. And then the other person, who was the Republican, they had to do the Democrats. And, oh, so access is sort of important. And access to what? What system? The various programs and the hospitals. And so they learn, and then they flip it at the halfway through the semester. Then they have to go back and now go back and do their own. So it helped them sort of get around picture of healthcare in sort of a sneaky fashion. But they became less angry at the other side and a little bit more tolerant, which I thought was helpful. The other thing that I did is I I like your admonition of short and simple. And the New England Journal of Medicine and JAMA have these, the New England Journal of the Perspectives, and JAMA has the Viewpoint. They're 1,200 words, fast, quick, and they're usually not partisan. They're pretty much, straightforward. And they learn so much because it's a quick read, and then they get exposure, because many of them think, oh, JAMA or New England, that's just a doctor magazine and they're the enemies. And it exposes them to, well, what are the doctors reading? What are the policymakers reading? What is the media reading? And that's been sort of a nice way of maturing them up to get out of their boxes.
Great, thanks. I want to, before we go to the other microphones, just share a couple other resources. One is, so the cartoon piece, Kaiser Health News, should be, I think, required reading of any program, that all students should have to read Kaiser Health News. Transparency, I'm on their National Advisory Council. But I believe that they do a very good job of balanced reporting, and they have a daily cartoon, but they also have a daily haiku. And you can submit a daily haiku, and most of them are listed a haiku poem. It's a kind of poem. It's a poem, very short poem, with certain rules. But for those people who are poets in the audience, you should submit one. You'll see that most of them say anonymous, and I think it's because the staff write them, because they don't get submissions. Health Affairs is now publishing poetry related to health and healthcare and health policy, and I'm pleased that my center's senior fellow and poet in resident, Jory Jacobson, who used to be the managing editor of the American Journal of Nursing when I was there, there were 3 poems in the inaugural launch of the column on poetry, and hers was one of those. So when you have poets in your class, that's one way. Instead of maybe an op-ed, they can do a haiku poem. Another is that the American Academy of Nursing, I think, still has funding for Jonas Scholars, policy scholars. These are for postdoc and doctoral students, and we've done postdoc fellows where they're assigned an expert panel, they work on policy briefs, et cetera. And so it's a great opportunity for doctoral level students. And finally, I think in addition to the op-eds, blogs. Huffington Post, what's her name? Monica Lamour is writing for the Huffington Post all the time. There are other blog opportunities to get messages out, and I think we should be encouraging our students to do that. And a good website that somebody passed up, you passed, yes. followthemoney.org.
Followthemoney.org is a great place to go. I try to give my students a lot of resources if they're trying to figure out who and what because of the issue with money and who's paying for the state legislature and who's backing them particularly. But followthemoney.org is a great place to send them to find out who is actually helping support the candidates and what they're looking at and which candidates are in on what, everything that they're doing. It's a great place to send them. And Ohio also has something called Health Policy Institutes of Ohio. I don't know if the other states have this or not, but it's been a phenomenal database kind of catch-all for everything in terms of your state legislature that has everything to do with healthcare. That if your state has one, utilize that immensely because that's where you're going to get your data from to be able to support all the stuff that you're trying to write. That has just been a gold mine for us and for the students, for when you're writing a grant, whatever you need to do. But that has been absolutely phenomenal for us.
Thank you. Yes.
I'm May Kang, and I'm from Florida State University, and I teach policy courses, obviously. One of the things that I believe is utilizing the power of media to influence policy. So one of the assignments that I have them do is to produce a no more than 2 minutes video. And at the beginning of the semester, they're all scared to death, and they didn't know how to do this and stuff. But I have I invite like news, TV news reporter, actually, she's a executive producer, to come talk to them, and then I encourage them to utilize their resources, whether it's a graphic artist or videographers and stuff, and they utilize their resources, and at the end of the semester they produce this video that actually one of the legislators put it on her website because she was sponsoring our bill. And so at the end of that, they loved it, and that incorporates technology into our doctoral education. So don't ask me to produce a video, but but I assign it to my students.
Yeah. It should go up maybe on the website as an example. It'd be great if you would share it on the website.
Okay.
It's a great example. Yeah, and I also have a framing exercise. My colleague Barbara Glickson and I do media training, particularly, for example, we've done University of Minnesota doctoral students and some faculty, and we've done a similar thing where in an advanced workshop we invite the journalists in, and the nurses pitch their stories to the journalists, and the journalists talk about what works, what doesn't work. But they've been able to get some coverage from these journalists for what they're doing. So, and last, I think Alexia.
Not to end on a down note, but I want to bring up a don't. I served on a policy board in the state of Texas a couple years ago, and I was the only nurse on this 15-member policy board that had like 8 physicians, do the ratio there. And we were working on scope of practice as one of the themes in the committee. And there was kind of an alliance going on with the Texas Association of Business, which is very supportive of nursing and full scope of practice in our state. But we had worked strategically with the Texas Association of Business to do a presentation or to make a motion at this particular board meeting, which was open to the public. And we were on target, we thought, with our agenda. We had the pre-meeting before the meeting and all those things. But what happened to us that side-railed us was something very innocent, but it could have been prevented. It was a group of students who came to this meeting, which allowed public testimony. And the chairman, before this issue was brought up, asked if there was any comments from the public on the issue and did anyone want to speak. A graduate student, stood up, came to the microphone, very excited about scope of practice. I'm a nurse practitioner, very enthusiastic. Went way overboard in advocating for advanced practice nurses in our state. Off the topic, derailed it within the committee even. It was very devastating at that time to be the nurse on the committee sitting there, and this very enthusiastic student who was very innocent. But I wondered where the faculty was in this. The faculty was not present. They were sent to this meeting. But I just want to warn everybody, as you prepare your students to go, they're enthusiastic, make sure they know that there are limitations on what can be said and what can be done, and they need to know what the story is going on behind. I wish that faculty member who I actually knew had called me and said, Alexia, I'm going to have somebody at this, students tomorrow at this committee. Is there any background I need to know about? And I would have warned her, don't have anybody stand up and testify at this point, because there was too many dynamics. But I think we just need to keep that in context and make sure we don't send students out and they jump into these burning barrels and we all go up in flames because of that. So
Great point, Alexia, great point. Well, I want to thank everybody. Oh, who? Yes, Barbara. Go to the microphone. Have you had your Bloody Mary yet?
No, but I've recovered from my depression.
Okay, good.
I just wanted to mention something briefly that I think provides a fabulous opportunity for graduate nursing students who especially are interested in combining clinical practice with policy, to look in their cities or their states to see if there's a medical legal partnership. Because they're springing up all around, and they're fabulous because healthcare providers, as you know, get tired of treating asthma. And you write a script, you say this, the person then goes home and never comes back, or they didn't get their medicine, or they go to a home or an apartment, more likely, which is filled with lead or mold or mites or whatever, or smoke. And there are attorneys, law students and attorneys working with the clinical providers in these settings to help educate the patients as to what services are available. If they can't get bus fare to get back to you, then we're wasting money. But if you know that there is a public program that gives subsidized chits for buses, and I'm just using that as an example, or an existing lead abatement program or mold abatement, or they're taking these socioeconomic determinants of health and involving clinicians, physicians and nurses, and lawyers, social workers, who can get to start to address those external forces that so much affect the care you give. And they're fabulous. And it's called Medical Legal Partnership, and you can Google it, and it's perfect for graduate nursing students.
Yeah. And it raises, I think, the point, which is a really appropriate closing point, that we need to move beyond having nurses think about health care policy. If we're concerned about promoting the health of people, then it is about healthy environments, it is about education, it is about food, access to healthy foods, et cetera. And if we're not leaders on that, shame on us, because our foremothers, whether it was Florence Nightingale, Lillian Wald, Sojourner Truth, they were leaders in helping us to think broadly about what creates health and what influences health. And so shame on us if we're not passing that legacy on to our students. I would encourage you to take a look at what are the opportunities in your curriculum to address these broader issues. I want to thank Pam and Karen and Eileen and all of you for sharing some great ideas, and keep that thinking going. Good.